Okay, well, good afternoon. As I was originally invited to present in a Welsh context, Prynhawn da pawb. Good afternoon, everyone. You will find that my slides do have a Welsh slant, but that'll become apparent why shortly. But by way of introduction, I work for the Environmental Public Health team. I'm not a medic. My background is environmental health, and I've worked mostly in local government, but for the last 3 to 4 years, I've worked in the Environmental Public Health team. And our remit is to give advice to Welsh Government, the rest of the NHS in Wales, the public directly, on threats to health other than communicable disease. So that includes air quality, for example, contamination of water supplies, contaminated land investigations, incidents involving plumes of smoke over people's homes and properties, through to dealing with planning and permit applications that might be seen as controversial or perceived as controversial, giving independent public health advice. We also look after the Extreme Weather Service, and we have an interest in climate change. So here are some examples of extreme weather in Wales. And as most of you know as meteorologists, the UK experiences very volatile weather anyway. It has done because of the complex weather systems that play over us. So therefore, we do have extreme events. Top left is some pictures of some snowfall that we all ground us to a halt because it just turned up out of nowhere, although it was fairly well predicted this time. We've got, can I use this pointer? Yeah. We've got flooding in North Wales. This is Barry Island in the south. Like most of us in Wales, as soon as the sun comes out, people flock to the seaside, isn't it? Let's make the most of it. And of course, we've got Aberystwyth here, which featured very heavily in the coastal inundations, for example. So because we have these extreme events, we have guidance. And we have guidance, especially at the moment, on extreme heat, extreme cold, and flooding. And the hyperlink there is that you can download that and you can access this on the public-facing website. It's in English, and crucially in Welsh, because we have to in Wales. And I know that quite a lot of our flooding guidance is looked at amongst the Welsh language community. That's one of the features we've found interesting recently. And what I've put up there especially is that in the past we used to call this alert and guidance. Well, there's been a move this year away from the term alert. We see ourselves as a public health information system, but what we were learning is that local health boards, which are the local delivery system for health, were actually looking to us for a bit of a nudge to implement their emergency response systems. And actually our system wasn't really geared to that, so we needed to shift the nuance a little bit to actually say, well, our system is there for the general public and some of the care sector, but it's not an operational trigger. Okay, that's a key thing to take away if you're involved in the health services at all. Okay, that's me finished, thank you. Actually, not in all seriousness. Okay. So how does it actually work in Wales? Well, we work very closely with the Met Office. We've got Met Office advisors in Cardiff that we can pick up and speak to any day, any time of the week. We also get all the emails and circulations natural hazard summaries that give us some idea of what the pending weather is like. So, as well as that, we get Natural Resources Wales, which is the Environment Agency in England. They circulate information in advance of potential flooding or coastal inundation. And we use that intelligence to try and make a decision in advance. So we will speak to the Met Office advisor, and what we're looking for in Wales is whether it's extreme. So, yes, it's winter time, or it's summertime. It's going to be cold, but how atypical of it? Our system is reserved for those moments of extreme. If, as a result of advice from the Met Office, and we don't ask the Met Office to make the call, we take that information away and digest it ourselves, maybe with the Welsh Government, and think, yeah, this is truly exceptional. This is not something you or I, who are normally well and healthy, will deal with. This is something where the population needs to know. We will then trigger proactive information from our website. We have pre-prepared messages from experience. We have now tweets, etc., for social media, and we can make those come out within hours of making decisions to go ahead. We'll then discuss and alert Welsh Government because they want to know, and we'll also tip off our colleagues in the local health board, bearing in mind that this isn't a trigger for them. This is to say, look, Public Health Wales has now launched this information into the public domain. And because we have an on-call service, we keep each other informed all the time. The most important thing, we feel that there's a proportionality of action. And I'll come back to the contrast with England, which is quite significant, shortly. Okay, so we do have 3 sets of guidance, but that is broken down. We do have advice for health and social care professionals, so that's people looking after nursing homes, for example, what they could do. It breaks down what the kinds of symptoms people might be expected to see in periods of adverse weather. General advice for the public, of course. We've got lists of the kinds of health impacts, everything from heat syncope, heat rashes, through to quite basic things like sunburn, for example. Again, similar advice for health and social care professionals. And what's also quite useful as well, we're in a world where we can see large numbers of open-air events. So if you can imagine attending a pop festival and it's super hot, what things can practically be done by event and organisers to protect large numbers of people attending these events that might not otherwise be prepared. And some specific advice for looking after young children. So if you're a child carer or taking groups away, there's good advice in that. Flooding advice, again, general information. Most of us are aware of what the risks are. Some of the biggest risks from flooding are obviously drowning and falling and accidents during the actual heat of the moment, no pun intended. But what we are actually finding more and more of is that once the floodwaters have subsided and the Dunkirk spirit of trying to respond and manage the response to it, people might not return to their homes for days, weeks, months, possibly a year. And what the health evidence is suggesting now is that there's quite a lot of mental health impact upon that. If you can't get back into your own home for prolonged periods of time, you might have lost all your wedding photographs, children's baby photographs, they've been swept away in the floodwaters. These are becoming more and more focus of attention of health intervention. So once the flood is gone, there's still work for the public health to be involved and catering for those needs. And coping without mains water as well. We've got good advice for people who have got children who are on bottle-fed water. Sometimes it's easy to switch and go to a supermarket and get bottled water, but the mineral content of that water might not be appropriate, and it might not be hygienic enough for bottle-fed babies, for example. So going through that hyperlink that I had in an earlier slide, you can get more detail of this if you so wish. Okay, so England is very different. Their system is based on an agreement between the Met Office and themselves, where there's a public health alert system that's based on trigger values. So, for example, it'll be a certain degree centigrade for a period of time, which will trigger either a hot or cold response. And they have a tiered response based on those criteria. And the lowest level is year-round working, so making sure that the health messages are always there. And frankly, Public Health Wales does that as well. Each of those temperature triggers will then give rise to a different level of response, a different level of preparedness from the health authorities. Now, I don't propose to go through this in detail because you can look it up yourself, but there is a difference, and people do pick up on it. If you live in Powys, alongside Hereford and Worcester, or whatever, people will see that difference. You will see on the news, for example, there's an alert level 3 in England, but there appears to be nothing in Wales, which is geographically across the border, clearly. And that does cause some controversy. The good news, though, is that the underlying health advice is the same. It's my professional view, personal professional view, not necessarily a PhD, is that there's benefits in both systems. Sometimes you could be over-alerting the public. Being constantly on alert, when does the message then mean something? We focus on extremes. There aren't that many extremes. But perhaps what we should be remembering is that throughout all weather impacts, it's those that are most vulnerable. Most of us will cope well. We know it's summer, we know it's winter. We will, if you're fit and well. But for the young, the vulnerable, the very old, people already with underlying health conditions, people who can't understand health messages, that have special needs, those are the groups. The homeless, for example, have been in the news a lot these days, coming to the city centres. What about working with them? People who haven't got the right homes that are properly insulated, for example. So we need to keep remembering perhaps the more vulnerable groups in our practices. Okay, so I've talked about extreme weather, and that's always happened, as you know. Most of the response to date has been around like a civil contingency type response. So we know that flooding will take place if we put measures in place. But as you will be aware, that climate change is predicting that maybe these events will happen with more frequency and perhaps more duration. So there's a slight nuance there. We're geared up for an emergency response at the moment. But what if some of these situations become more common, more sustained? I'll just go back one. The UK Climate Change Risk Assessment, I'm not sure if anyone's been directly involved with this, but I've given you the hyperlink to it. It's a fantastic, quite easy to read document, especially the synthesis overview report, which talks about the risks across the UK. And each, England, Scotland and Wales has its national summary as well, which breaks down the risks. And each of the risks have been given a score, whether they need to be researched more, whether there's enough going on in terms of current policy making, etc. So I do commend this document. I'm sorry the image doesn't come out that well, but the link should work for you. Now, this is not in the climate change risk assessment, but for anybody that's new to climate and health science, I like this slide. It really, in a nutshell, it's not my own. There are credits on the actual slides. It does break down quite nicely the effects that you might expect. So here are the environmental effects. You've got extreme weather, fires. I was out in the British Columbia last year, and the fire season was immense. They were used to fires, but for the first time, British Columbia, Vancouver City was engulfed in smoke at very high values, frankly, at levels that were causing concern of air quality. So now we're not just seeing the classic hot, cold floods. We might see more wildfires. South Wales has a particular problem with wildfires, mostly because of social issues, but the conditions that allow the fires to ignite and therefore spread in steep-sided valleys with high populations is now of growing interest. Drought. Do we need to be worried about drought? Well, what was interesting in the UK Climate Change Risk Assessment, one of the overall UK risks was risks to the public mains water supply. Whoa. So we've got a great water system in the UK, haven't we? All the water companies have got drought plans, haven't they? But yet it's come out as one of the top 6 risks, cross-cutting everything, because you need water for industry, you need it for agriculture, clearly. So what's the risk there? Trying to sell drought risk in Wales is interesting. We have lots of water that falls from the sky, but it makes its way to the sea quite quickly, so we don't necessarily have ground storage. But that's a risk we need to explore more. Flood and temperature we've talked about. Then, of course, there's all the consequential impacts and social impacts that you get, displacement. We've got abuse and displacement, infrastructure problems, etc. And all these conspire for human health impacts. It's a nice little slide to use, isn't it? So what I've done, very quickly, is the climate change risk assessment is broken down into all different subject headings. And as you know, climate change is actually quite a cross-knitting, and it recognises that there are cross-cutting themes. But I've extracted what are the health queries that are now being generated. What do we need to look at now into the future? What do we need to understand more? So starting with health, which is my domain, primarily, we want to look at the risk to health infrastructure. Sometimes if you had the unfortunate reason to visit a hospital, they can be stiflingly hot. You're already vulnerable, you're there for a reason probably, or you're visiting, but they can be extremely hot. So if the world is getting warmer and we can't cool the hospitals down, we might actually be bringing patients at risk. What if the models of delivering service change to one of treating people more in the community? I don't mean that from the whole the politics, but what if we start having to get out to people more, but we're faced with more floods and more snow? Do we need to start thinking about how those big policy decisions might be influenced in the future by more sustained environmental threats? And we need to look at the demography, the social care. So whilst we might expect in a warming world to see less people die in the cold and more people to die in the hot weather, is that really true? Or will we find that actually, because the population is increasing, we can have more elderly people, and more elderly people mean more people might die because there's certainly just more people there who will be subject to that risk. So all these things have to be taken into account. Oops. So buildings, for example, we all live and work usually in buildings. There's a push on now for housing. Most news articles contain something about needing to rebuild properties. Are we building the right kinds of properties? Most of us are in homes that have probably been built, possibly, for generations. So we could be building now and storing up problems in the future. Certainly we need to make them warm for those cold conditions, but we can't make them warm and not thermally efficient. There is a difference. We need to make sure that we're not storing up problems. If we placing people in more and more tighter boxes. What about carbon monoxide? What about radon gas? All these threats that previously, well, you can deal with, but you might be making a new range of exposures and hazards. Vector-borne disease, that's another classic one. But we might see that there's a shift in vectors actually occurring, and there is surveillance. Public Health England colleagues there have surveillance and some curious research that goes along the M25, for example, at the motorway service stations. This one fascinates me. They actually, when you go maybe with a freight company or maybe with your caravan across the continent, you'll inevitably pick up some insect in your luggage or in your vehicle. And of course, when you drive quite quickly now across the continent back into the UK, you stop for a cup of tea in the M25 and motorway service station, and the insects pop out. And actually, these vectors have been found. The chance that you find vectors does not necessarily translate then into a public health risk, because it might be that there are other factors controlling the parasites that they carry, for example. But we need to start building up that understanding of risk. We need baseline knowledge. There's 3 airports in Wales, in the south alone. There's a military airfield. We need to start looking at the right level of surveillance for certain vectors, for example. Air quality has been very much in the news recently. At the moment, we are very much geared up for measuring mostly nitrogen dioxide and PM10, particulate matter. But some climate models suggest we might start to find more low-level, ground-level ozone. Now, I know from experience of actually monitoring this on the ground that because of economic pressures, we've switched off some of the ozone monitors because we don't really need them at the moment. But yeah, that could become something that we need to reactivate. Settlements and communities. One of the curiosities that's come into this is how we value our social and cultural places as well. In the health chapter of the risk assessment, it's thinking about tourist attractions, access to open spaces, how we might do that. One of the most positive things about climate change is that we might find that we go out more and enjoy the weather more and become more physically active, which is got a plus in the health side. We'd hope that it would be offsetting from any risks of UV and skin cancer, for example. Urban heat islands, some of you might be aware of that, where the temperature within an urban environment tends to be a few degrees warmer. And curiously as well, I keep forgetting about this one, is in transport. Now, when the climate change risk assessment was constructed originally, there was lots of interest around London. And if you've been on the tube in warm weather, it's actually quite stifling. So we need to make sure that our transport infrastructure is geared up to be air conditioned for the future. So what we're finding now, for example, is that instead of the traditional health impacts, we need to look more widely. And one other, how long have we got to this? Okay. Some examples that we might take for granted. Foodborne disease. Well, we might, the way we actually prepare and make food, barbecue season might be longer. But what does that mean? We might have people who are handling food in a way that's inappropriate for the warm weather. Hopefully we'll just all adapt, but we need to start thinking, is there more of a risk to health? These are risks that we need to explore. Algal blooms. We are seeing these, maybe anecdotally, happening earlier and later in the season. And these have impacts on tourism, they have impacts on leisure. And we need to begin to understand those risks. And it's people perhaps like yourselves, I don't know if anyone's directly involved in research in the climate change risk assessment, but if you aren't and want to be, get involved in the process. The contacts are all well built into the climate change risk assessment documents. Okay, I mentioned from the outset that this had a Welsh perspective. And what's important, and I'd like to flag up for you all, is that we have a new act in Wales called the Wellbeing of Future Generations Act. It's groundbreaking. It's the first of its kind in the world. It actually now requires everybody from the Welsh Government through to Public Health Wales, through to some quite large organisations. They are now mandated to take into account impacts of decisions now on future generations. And in summary, it's using the Sustainable Development Principles. People have to work together to show evidence that they're collaborating. Ministers and everyone else below ministers making decisions have to regard to the climate change risk assessment. It's no longer a nice thing to do, if we could. We are now mandated in law to consider climate change and the risks to future generations. Anyone here that's studying social elements of the environment, can I commend that you at least look at this act? It is superb in its concept. It's early days. It's still new to us. How do we take some of these quite large concepts and mould them into something useful? But it's happening. And for the first time, we are seeing climate change being built into local risk decisions on a routine rather than an ad hoc basis. We have the Environment Act Wales. The reason I flag this up is that we are now, the Natural Resources Wales is mandated to create a state of natural resources where it looks at all the natural resources from forestry to fisheries, through to even air quality in some cases. And that translates into local area knowledge as well. And given the interface with the Wellbeing Act, that knowledge now starts to cross-pollinate in a very positive way. We now have to look at these things. This umbrella, it's truly a step change in law. The water strategy for Wales talks about the way we manage our water supplies, and again in a sustainable way, and it's underpinned by new planning legislation. I don't intend to go through this in huge detail, but if anyone is involved in social science, take a look at these acts, and yet again I commend this one. But what are the next steps of climate change risk assessment in Wales? Well, like England, we are now mandated to take into account what this means. We've highlighted some of those risks. Some of those risks may be manifest, some not. We might be doing okay, but we just need to understand those and prove that we're looking at them. We agree with the conclusions, Welsh Government agrees with the conclusions of the Act, and we have to then publish an adaptation plan. So using the evidence and the current state of knowledge, we are part of a process of funneling in through Welsh Government into the adaptation plan, as will be happening in England. And of course, we can't do this in isolation. The climate in Wales is not too different from England. We might have some unique issues in terms of coastal flooding, perhaps, but most of us share a common threat. Perhaps just to finish on one example, I mentioned water supply, and I mentioned about the mains water supply. Well, in Wales, there's an estimate that 80,000 people are in some way connected either through living and consuming or through industry involved in private water supplies. What happens if we get small villages and communities that not just now and again get dried up? What if whole communities start to dry up? Then certainly not something we're used to. So we're working with the British Geological Survey. We're working with the Drought Risk and New project based out of Bristol to try and understand that risk. We're looking more at the geology and how it holds water, or how it may not. We're looking at social science to try and explain how people adapt when they haven't got water. And we're trying to understand what that risk is. Because if we need to start planning ahead infrastructure for perhaps providing a mains water supply pipe to a small community, that has to be forward planned. We can only do that once there's evidence and research. So that's very much a whistle-stop tour through public health and weather. But hopefully this will be the beginning of a two-way process. If you have interest in research, come and see me later. We can only learn from the actual research done by yourselves in the audience. Okay, that concludes my presentation. So I'm quite happy to take questions on quite a broad subject area there.
Very good. Yeah, right.
You mentioned the adaptation earlier on, you talked something about how does the NHS operationally work when they have forecasting of an extreme event coming off? Do they build up operational kind of readiness? And how is that going to change into the future? Are you planning for increasing that, or are you planning for that into the future?
The most way for us that each local health board, because we're technically divided up into different boards, and they will have their own plans for emergency events, whether it be weather or something else. And it's down to them to make the operational decision, because sometimes flooding will only occur in one region and might not in another. Going back to the beginning, we give public health advice generally to the population, and as I said, we don't give operational decisions to the health board, but they would do it on a risk assessment. And I do actually see us becoming actually more interfaced really in the future. They're going to need to know more of the evidence as it develops. Perhaps by illustration, people in cold weather start to die temperatures that are not necessarily extreme. 4, 5, 6, 7, 8 degrees, you might find people dying, and that's not necessarily extreme. But that underpins the need to keep basic advice and awareness going for those. Also, you might find that the sharpness of the onset of a season might impact on health. And sometimes how deep and how long and sustained the weather is can impact upon health. And we're beginning to see more research into this to enable operational planning to deal with that. But you might have a conspiracy of conditions as well, because whilst we might generally be better prepared for winter, because generally our housing stock is generally getting better, etc. If you have a flu epidemic at the same time, then that makes a lot more people vulnerable. So we are at an age where we're trying to build that evidence base to enable more accurate planning.
Any other questions? I'm trying to work out how it relates the METOS weather warning maps with the weather advice that you give for severe weather. Because presumably once the METOS puts something on, you must be obliged to comment on something.
Yes. The key decision that is made by public health is that it's based on extreme weather. You will find that there will be other organisations making reference to weather before us. The other phenomenon of the time, of course, is the media. We will often get queries out of nowhere asking us, is this the heat wave that is being forecast? And we can only work on fact and accurate predictions from the professional services like the Met Office. So you do sometimes see the media create a prediction of extreme that is not going to be manifest. And I would agree there are times when things might seem slightly out of kilter, but the decision operationally, because of various reasons, and it's political in terms of what's been arranged between the Met Office and the large government and Department of Health and the Met Office, is that we are focused on the extremes. We don't have that tiered system. So you will see potentially a discrepancy in terms of when the warnings actually come out. But ours is based on what is. It might do. It might do. I know it's been an issue for, I said, health boards that may straddle services across borders because they're wondering why is I used the example Hereford have gone to an alert level. And I think whilst the advice is the same, and this is my professional view, is that there are pros and cons of both. And we speak to our colleagues. The weather team is many times bigger than our entire team in Wales. We have professional discussions, and I think there is an appetite to try and make it more unified. We'll deliver a similar message. Because the advice is always the same. If you are too hot or too cold, you can go to these pages and get that advice. But the art of it is giving the public the message at the right time. Because there is a fear in some cases of a backlash, perhaps, of overwarning, that we'll alert the level again. What does that mean? So what can we have in the back pocket that is going to be a warning to the general public? It is an evolving process.
Yeah, sorry, I had a question about the trigger threshold. So obviously there's variations in extreme events as a country with individual police. But how much of those variations, so it's a pre-reportedly variation across the British Isles or the UK in terms of heat wave, or what is the price of heat wave with extreme weather? Yeah, how much of that's why I've seen on the web, but how much are they based on physiological or psychological perceptions or people's different vulnerabilities according to the...
It's very much, first of all, about the regions. Obviously, England's large, and therefore you will find that warnings are posted for regions because the weather's not going to be exactly the same across. So there will be staged warnings depending on where you are in the UK or Wales. The trigger values, my understanding is that in the working with the Met Office, they were geared up for a certain threshold that would trigger a certain number of alerts within any one winter season, and therefore it's the likelihood of them actually happening. Now there is work to try and knit more closely the epidemiology to trigger levels, and that is an ongoing process. As I mentioned at the end of my general speak there, people still die not at extremes, so I think that the way we deliver it will change in the future. And perhaps the fundamental point that I want to make is that we are changing now from the occasional extreme event to the climate prediction models, and I rely on your expertise to tell us about that. We might be seeing more sustained periods of those events happening. And that's the nuance, perhaps, to explore.
On the same sort of area, I think the cold weather and the hot weather plans in England are focused on the professional, on advice to the professionals, and not to the public. And so the advice to the public is then sort of the result of the communication between Public Health England and the Met Office, which then results in sort of general guidance. I think the actual tiered alert system is for professionals. But I wondered whether there is a similar feedback on the message for the public to be included in the Met Office warning or Met Office advice from your discussions with Met Office colleagues.
Yeah, I think it's recognised nationally between the two countries that there is an issue, the level of the agreement and information shared. It's not negative necessarily, but it's just recognised as an issue. I think the key thing is that we need to make sure that the public health message is seen as the public health message and it's not a trigger for the medical services. That's not how it works yet.
Which is how it does work in England.
Yeah.
And what it's for? It's not for public.
Yeah. Although you would find that lots of it is, yes. And so the point I've not elaborated on is that would people necessarily go to public health for advice in some cases? And what I mean by that is that you will look at your BBC or ITV forecast and they might have links to Met Office information. Would you go to Public Health England or Wales for advice on health and flooding, or would you go to perhaps Natural Resources Wales, who are the leaders? So there is work afoot now to look at where that message is best delivered and whether there could be perhaps one central point of advice where everyone could go, for example, on flooding. We'd still maintain our independent professional advice, but looking at the way people interact with that information is important as well. And one curiosity as well is that often things are now produced in a electronic form. But often if you're in a flood, perhaps the first thing that you lose in the flood is your power supply. And you might also, in a national incident, lose your mobile phone signal. So if you're relying purely on a email or a Twitter account, you might not get it. So there might even be some really practical things to do that people can download information in advance, laminate it. Is it printed big enough that you can see it in the torch? At night, and this might sound silly, but this is feedback we do get from people who have things like that. And they need it practically as well as electronically. Because it's all on the internet doesn't mean it's the best way of delivery. But the fundamental question is, between England and Wales, there is a difference. Whilst the advice from the public is very, very similar, there is quite a quantum difference in terms of the way it's delivered as a work system. And if you want to know more about the English side, the links will take you directly there. It would be a subject matter of its own.
Just picking up on that, do you have a sense of how much it's used? Because I find it really interesting you say, you're actually getting feedback from people in floods who say, what we really need isn't a website, but an API. Do you get a sense how much advice is being used and acted on?
We track our web, like most people, of the web usages, and we found that one of the curiosities was that we get a lot of Welsh language requests. That might be because of the geography, perhaps, in certain areas. We also link well with Natural Resources Wales. We sit with Welsh Government and the Flood Group. So we do interact with all the different agencies to find out what is required. And often we'll get invited to a meeting of maybe local community flood leaders where we can sit down and say, this is what we've currently got. Is this meeting your needs from reality? And therefore there's a two-way process of informing what's needed.